Greetings. Today we explore what habits help you stay healthy after age 50. At 50, your body enters a fundamentally different phase. Anabolic hormones decline, muscle mass decreases at roughly 3 to 5% per decade, accelerating after 50. Mitochondrial function deteriorates, recovery takes longer, and your margin for error shrinks dramatically. The truth be told, these things started to decline after 20 for most people, although it doesn't have to happen. The good news? Most age-related decline is optional. It's not destiny. It's the result of accumulated lifestyle choices and environmental factors. The habits that matter become more consequential over time, not less. 1. Strength training. Not optional, non-negotiable. This is the single most important habit for healthy aging after 50. It's not optional. It's not nice to have. It's foundational. Why it's critical? Sarcopenia, age-related muscle loss, is the primary driver of frailty, falls, disability, and loss of independence. You lose 3 to 10% of muscle mass per decade after 30, accelerating after 50. By 70, you've lost roughly 30% of your peak muscle mass unless you actively resist this with regular strength training. Muscle loss directly predicts mortality risk, fall-related injury risk, metabolic dysfunction, loss of independence, cognitive decline. Muscle is metabolically active. The research is unambiguous. Resistance training 2 to 3x weekly maintains muscle mass, strength, bone density, metabolic rate, and independence better than any pharmaceutical intervention. The practical reality: progressive resistance training, weights, bands, or body weight, 2 to 3 sessions weekly, targeting all major muscle groups. Focus on compound movements, squats, deadlifts, rows, presses, carries. Progressive overload, gradually increasing resistance. This isn't optional if you want to stay functional. The catch: recovery becomes critical. You need adequate sleep, protein, and recovery time between sessions. Your 50-year-old body isn't likely to bounce back as well as your 25-year-old body did. I'm the digital avatar of Dr. MacCloud, aka the Nutrition Ninja Doc. His passion and purpose are to solve health problems to help people achieve their health, performance, and appearance goals. He utilizes AI to save time, allowing him to spend it helping others. With over 45 years of clinical experience, he has acquired extensive specialized health-related knowledge that he wants to share, which is why he produces videos. Please note that this is not medical advice. It is for educational and entertainment purposes only. Consult your trusted progressive healthcare provider before making any significant changes in your health regimen. Now, let's get back to today's topic. But before that, I ask you to please hit the like button if you find this information helpful. Subscribing to this channel helps get this information to more people. 2. Sleep, the biological non-negotiable. Sleep quality deteriorates with age. Circadian rhythm shifts, slow-wave sleep decreases, and sleep fragmentation increase. Ignoring this is like trying to drive with an engine light on. Why it matters: during sleep, the lymphatic system clears amyloid beta and other protein waste from the brain. Growth hormone is released, critical for muscle and bone maintenance. The immune system consolidates memory and mounts defenses. Metabolic dysfunction accelerates without adequate sleep. Poor sleep after 50 predicts cognitive decline and dementia risk, cardiovascular disease, metabolic dysfunction and weight gain, increased fall risk, accelerated biological aging. The non-negotiable targets: 7 to 9 hours nightly, not negotiable. Consistent sleep schedule, within 30 minutes daily. Cool, dark bedroom, 65 to 68 degrees Fahrenheit optimal. No screens 1 to 2 hours before bed, or at least wear blue blocker glasses for a couple of hours before bedtime. Do not expose yourself to any bright lights within 2 hours of bedtime. No caffeine after 2 p.m. Limit fluid intake for the last couple of hours to minimize the need to get up and urinate during the night. You don't need to be too restrictive, just limit the total volume. If frequent nighttime urination is a problem, try ordering and taking posterior pituitary glandular capsules for at least a few weeks. If it works as it should, keep it up as needed. The posterior pituitary regulates how well the kidneys concentrate urine. So by using this glandular extract, you can help to reset your kidneys to concentrate your urine more, which means your bladder won't fill up so fast. Regular morning light exposure regulates circadian rhythm. Why this matters more after 50? Your body's sleep architecture is more fragile. A night of poor sleep triggers cascading metabolic dysfunction that takes days to recover from. This isn't the case at 25. 3. Cardiovascular function, the often ignored foundation. After 50, your cardiovascular system requires active maintenance. This isn't just about aerobic exercise. It's about vascular health, endothelial function, and blood flow. Why it's critical: cardiovascular disease remains the leading cause of death. But more importantly, cardiovascular fitness is a proxy for longevity across all causes. People with poor cardiovascular fitness have 2 to 3x higher mortality risk than those with good fitness, regardless of age. The practical approach: Zone 2 training, low-intensity, steady-state cardio 3 to 4x weekly. Conversational pace, 60 to 70% max heart rate. Zone 4 to 5 training, higher intensity intervals, 1x weekly, if healthy enough. Walking, daily movement, especially important for metabolic health and cognitive function flexibility. Include dynamic stretching and mobility work. Extra credit for those who are serious about age reversal. EWOT, exercise with oxygen training, may be the most important exercise you can do. It's right up there with resistance training because it is the only thing ever shown to open and reset the microvascular system. The microvascular system, primarily capillaries, accounts for 99% of the entire vascular system, and it is the only place where nutrient exchange actually takes place. Everyone's microvascular system declines with age, and only recently have we been able to assess this using the glycocheck technology. EWAT, together with several specific nutrients, works together to repair, reset, and regenerate the blood vessels throughout your body. Why Zone 2 matters after 50. High-intensity training remains valuable but becomes riskier and requires more recovery. Zone 2 training builds aerobic base, improves mitochondrial function, increases capillary density, and is sustainable long-term without excessive injury risk. 4. Nutrition, not a diet, a system. After 50, your nutritional needs shift. You need higher protein to maintain muscle, better micronutrient density as absorption deteriorates, and consistent caloric balance. The framework: protein, 0.5 to 1 gram per pound of lean body weight daily. This is crucial because protein synthesis efficiency decreases with age. Unfortunately, most younger people also fail to get sufficient protein consistently, which contributes to the loss of muscle mass and lean body weight over 30. Don't skimp here. Whole foods minimize processed foods, not because they're evil, but because they're nutritionally dilute. Okay, so they are also evil. Your digestive capacity and micronutrient absorption are declining. You can't afford caloric waste or junk foods that upset metabolic balance or homeostasis. Anti-inflammatory pattern, emphasize fatty fish 2 to 3x weekly for EPA, DHA, colorful vegetables, polyphenols and antioxidants, legumes, fiber, resistant starch, plant protein, nuts and seeds, healthy fats, magnesium, olive oil, Mediterranean pattern. Minimize most seed oils, refined carbs, and sugar. Pumpkin seed and avocado oils are the exceptions that can and should be used in moderation. Caloric balance. Metabolic rate decreases roughly 2 to 8% per decade. You need fewer calories but equivalent or higher nutrient density. This means portion control without malnutrition. Hydration. Thirst sensation diminishes with age. Drink water consistently. Dehydration accelerates cognitive decline and increases fall risk. 5. Strength and balance training, specifically for fall prevention. Falls become increasingly consequential after 50. A fall that you'd walk off at 25 can cause a hip fracture at 65, and that can end one's independence quickly. Why it's distinct. Falls result from loss of balance, strength, and proprioception, all trainable. Single leg stance, weight shifts, uneven surfaces, and challenging balance work prevent falls more effectively than any pharmaceutical. The practical approach: unilateral leg work, single leg deadlifts, lunges, single leg squats, balance training, balance board, single leg stance, eyes closed progressions, core strengthening, planks, crunches, back extensions, and rotational work, proprioceptive training, unstable surfaces progressively. This can be integrated into regular strength training but deserves specific attention. 6. Cognitive engagement, use it or lose it. Cognitive decline accelerates after 50 if you stop challenging your brain. This isn't melodramatic, it's how neuroplasticity works. It is just like muscles. Use it or lose it. Why it matters. Cognitive reserve, your brain's resistance to damage, is built through education, cognitive challenge, and learning throughout life. After 50, this becomes maintenance work. The approach: learn something new regularly, language, instrument, skill, read complex material, problem solving, and puzzle work. Teaching others forces deeper processing, social engagement, particularly with diverse people, physical training that requires coordination and balance. The research is detailed. Cognitively engaged 70-year-olds outperform cognitively passive 55-year-olds. This is trainable. 7. Stress management, the underrated accelerant of aging. Chronic stress is corrosive. It accelerates biological aging more dramatically after 50 than at younger ages because your stress-resilient systems are declining. Chronic stress elevates cortisol, suppresses immune function, increases visceral fat, accelerates telomere shortening, impairs sleep quality, increases inflammation, impairs cognitive function, increases cardiovascular disease risk. After 50, your ability to tolerate chronic stress physiologically diminishes. Something tolerable at 30 becomes destructive at 60. The approach: regular meditation or mindfulness practice, social connection, primary stress buffer, nature exposure, creative pursuits. Adequate sleep, stress and sleep are bidirectional. Physical activity, excellent stress buffer. Set boundaries, stop saying yes to everything. This isn't luxury, it's maintenance. 8. Regular health screening and biomarker monitoring after 50. Knowing your numbers isn't optional. Essential screening: blood pressure, annually, more often if elevated. Lipid panel, annually. Fasting glucose and HbA1c, annually. Liver and kidney function, annually. Complete blood count, annually. Vitamin D, B12 status, annually. Homocysteine if cardiovascular risk factors. Carotid ultrasound if cardiovascular risk factors. Bone density scan, especially important for women after menopause, men after 70. Cancer screening, colonoscopy, mammography, prostate screening as appropriate. Why this matters: early detection of metabolic dysfunction, deficiencies, or disease allows intervention before irreversible damage. This is different from treating disease. This is prevention. 9. Movement throughout the day are the forgotten pillar. Formal exercise is important, but daily movement throughout the day might matter more after 50. Why? Sitting is toxic. Prolonged sitting independently predicts mortality, even in people who exercise regularly. Your body evolved for constant low-level movement, not 8 hours sitting punctuated by 1 hour of exercise. The approach: stand and move for 3 to 5 minutes every 30 minutes of sitting, walking meetings, stairs instead of elevators, park further away, walk after meals, especially carb-heavy meals, improves glucose control, active hobbies. This accumulates. 10,000 steps daily is reasonable. Sedentary individuals should aim for 7,000 plus minimum. 10. Social connection. The longevity secret. Nobody talks about it. This is as predictive of longevity as smoking is predictive of mortality. It's not optional. The research. Social isolation increases mortality risk by 26 to 32% across age groups. Loneliness is as harmful as smoking 15 cigarettes daily. After 50, social isolation becomes increasingly common. Retirement, empty nest, spousal death, and increasingly consequential. The approach. Maintain close relationships, not just acquaintances. Community involvement, church, clubs, volunteer work. Regular family connection. Develop new friendships. Group exercise combines two benefits. Purpose-driven activities. Humans are social creatures. This isn't optional for healthy aging. 4. These habits don't work in isolation. They interact. Strength training improves sleep quality. Good sleep enables better training recovery. Regular movement improves cardiovascular health. Stress management improves sleep. Social connection reduces stress. Exercise enhances cognitive function. Good nutrition supports everything. Optimize one, and the others become easier. Neglect one, and it undermines everything else. Can you stay completely healthy after 50? Yes, you can, but it will take some effort. Chronological aging is inevitable, but biological aging can be slowed and reversed with the right input. These habits dramatically influence the rate of biological aging and decline. You can't stop the clock, but you can choose between minimal graceful aging and accelerated decline. What's the single most important habit? If forced to choose one, resistance training. Muscle mass decline is the primary driver of functional decline and loss of independence. Everything else supports this. What if you can't do all of these? Prioritize in this order: resistance training, non-negotiable for maintaining function. Sleep, non-negotiable for recovery and health. Whole food nutrition supports everything. Daily movement prevents sedentary decline. Cardiovascular fitness supports longevity. Stress management prevents accelerated aging. Social connection supports both mental and physical health. Cognitive engagement preserves independence. Health monitoring enables early intervention. Balanced fall prevention maintains independence. After 50, your body becomes more prone to damage and degeneration. It requires more intentional maintenance, better sleep, consistent training stimulus, superior nutrition, and stress management. This isn't pessimistic, it's realistic. The good news? These aren't mysterious or complicated. They're well-established behaviors that reliably extend both lifespan and health span. The people living vibrant lives at 70, 80, and beyond aren't lucky or genetically blessed. They're the ones who prioritized these habits when they were still optional. Of course, being genetically blessed also helps. The habits you develop now determine the quality of your life from 70 onward. That's not dramatic, that's factual. Start now. Your 70-year-old self will either thank you or curse you for the choices you make today.